Good day, everyone. So excited to be here today and glad to have you all joining this very important webinar today. Good morning, good afternoon, wherever you are joining in from across the world. We are most grateful for your participation in this webinar today. You're welcome. Please kindly introduce yourselves, your name, and where you are calling or joining in from in the chat box, please. And if you already have questions to ask during the course of this webinar, please use the Q&A section and we will respond in due course. Once again, you're most welcome to this webinar today. Thank you so much. We can see where you are listening in or joining in from across the world. Thank you for the introductions. You are most welcome. So we'll be starting the webinar immediately now and ensuring that we are fully aligned with the time for this webinar today. So once again, you are most welcome. All right. Now, on behalf of the West Africa Health Organization, it's my pleasure to once again welcome you. And we have very important personalities in our midst across our different organizations, partner organizations across the world. Our West Africa organization is a key and lead partner in this fight against Lassa fever and other epidemic-prone diseases across the region. So today, I have the honor and privilege to welcome the representative of the Director General of the West African Health Organization, Dr. Metio Icy, who is ably represented today by Dr. Aishat Usman. Dr. Aishat will be giving the opening remark on behalf of the Director General, West Africa Health Organization. Hi, Dr. Aishat. Nice to have you and welcome.
Thank you. Thank you, Dr. Uwa. And good afternoon, morning, everyone, distinguished panelists, speakers, partners, colleagues, ladies and gentlemen. I bring warm greetings from the leadership of the West African Health Organization. On behalf of our Director General, Dr. Metio Icy, it's a pleasure to have this edition of another ECOWAS Research and Development Lassa Fever webinar series today. As you all know that this discussion is important for us as a region with the recent events around the Bundibugyo Ebola virus outbreak in the Central Africa. One important lesson that we need to bear in mind is that preparedness is not built during an emergency. It is built beforehand through deliberate investment in research, surveillance, laboratory system, workforce development, community engagement, and regional collaboration. As most people are aware, that Lassa fever is a disease that is endemic only in West African countries. While this threatens the health security of our region, it has also provided opportunity for us to be better prepared for other infectious disease outbreaks. Over the years, significant investment has been made to strengthen member states' capacity to prevent, detect, and respond to Lassa fever outbreaks. These investments have supported the establishment of research networks, strengthened laboratory and clinical trial capacities, improve surveillance systems, and foster collaboration among institutions and countries across the region. Beyond the traditional public health aspects, we have also strengthened our contribution to global vaccine therapeutics and diagnostic research and development efforts. These investments generate benefits that extend far beyond a single disease. Capacities developed for Lassa fever research and preparedness can also strengthen our ability to respond to emergent threats and to meet the 100 days mission goal. Today's webinar is an opportunity to explore where we are from a vaccine research preparedness point of view, how research sites and member states are leveraging capacities, and how we can continue to build and sustain these opportunities. In addition to technicalities that come up with these, such as setting up clinical trial sites, training skilled staff, and others, we must also think about the glue that brings us together. We must continue to strengthen regional collaboration, promote greater alignment of research and preparedness priorities, and ensure that evidence generated through research is translated more rapidly into policies and actions that can protect our countries. As a specialized health institution of ECOWAS, WAHO remains committed to supporting member states, strengthening regional coordination, and fostering partnerships required to advance the health security across West Africa. Today's webinar provides an opportunity to reflect on lessons learned, examine how research investments are contributing to preparedness, and identify practical actions that can help build more resilient systems for the future. I encourage you all participants to engage actively in the discussions and to share experiences and perspectives that can help strengthen our collective preparedness for future epidemic threats. I would like to thank our distinguished panelists, speakers, partners, and participants for joining today, and I wish you a productive and insightful discussions. Thank you.
Thank you so much, Dr. Aishat, for that remarks on behalf of the Director General, West Africa Health Organization. Thanks. I'll be taking the objectives why we are here today for this webinar. And these objectives are very critical in ensuring the outcomes of this webinar is really driven home to all our stakeholders around the world. First, we would like to examine how the investments in Lassa fever clinical research have strengthened broader research preparedness systems across West Africa. We'd also like to explore how disease-specific research platforms can support multi-pathogen preparedness and outbreak response. Also would like to examine how preparedness capacities strengthened through Lassa fever research investments can support responses to Bundibugyo Ebola Virus Disease outbreak and other emerging infectious disease threats. Lastly, we would also identify lessons for sustaining resilient, regional-led research ecosystems, and also to ensure that we have great insights for clinical research capacity. So these are the objectives for this webinar. And once again, it's my pleasure and privilege to welcome you to this webinar. Having read through the objectives of this webinar, I would like to respectfully invite shortly Dr. Christoph, who is the Clinical Development Operations Lead at CEPI. Dr. Christoph is a physician by training, and he has over a decade experience in managing clinical and tropical diseases, as well as vaccine research, and is here today to set the scene for the panel discussion that will follow. Hi, Dr. Christoph. It's a pleasure to have you. Now it's over to you.
Thank you very much, Uwe, for inviting me. It's a pleasure for me to be here today and to present a bit from CEPI's perspective of how we try to strengthen the clinical trial or the clinical research ecosystem across West Africa. I have prepared some slides, so if we can move to my first slide, I can directly start my presentation. So I was actually very pleased to see the topic that was suggested for this presentation, from Lassa fever to Bundibugyo Ebola Virus Disease, how research investments are strengthening epidemic preparedness in West Africa. This is exactly what we tried to do over the past years and what we will continue to do over the next years. Next slide, please. I have included a map. This is kind of, I think we all know this, a map that is unfortunately already outdated, just to show that epidemics and pandemics across the globe are really not rare events, but really something that we experience every year at least. We actually have experienced a series of severe outbreaks over the past 2 years in Africa alone, and CEPI was very much involved in many of these outbreaks in terms of responding with research and trying to advance the development of vaccines. Next slide, please. So for those of you who do not know CEPI or who are not too familiar with CEPI, we have been founded in 2017 with the vision that we create a world in which epidemics and pandemics are no longer a threat to humanity. And our mission is really to accelerate the development of vaccines and other biological countermeasures against epidemic and pandemic threats, so they can be accessible to all people in need. So we have a very narrow mandate. We're working on vaccines for epidemic, pandemic-prone diseases, but nevertheless, we try to look beyond this and try to really use the funding that we can provide to strengthen ecosystems beyond vaccine development. Next slide, please. I think we have a quite unique position in the ecosystem. We are very active, certainly in R&D. If you can go to the next slide. Yeah, thank you. We are very active in R&D, certainly. We are advancing vaccines from preclinical stages to clinical, partly late-stage clinical development. We are very active in regulatory and policy areas, and certainly also in manufacturing, especially on the African continent. I will come to that in a minute. So this is, I think, really a bit the distinguishing factor to the other great organizations who have been, in this ecosystem for a long time, as you can see on this slide. Next slide, please. I would like to show maybe 2 key areas that we are active in and that we use to strengthen clinical trial or clinical research ecosystems across the globe and mainly on the African continent. And the reason for that is really very visible, I think, on this slide. This is a very high-level overview of our vaccine portfolio. We are operating with priority pathogens, or nowadays viral families. And you can see that most of these pathogens can be found easily on the African continent. And this is why we are so active on Africa. I will, in this presentation, focus on Lassa fever because we are here. I'm invited from the West African Health Organization, and we have really chosen West Africa as one of our priority regions for some reasons. I'll come to that. But you can see really we are active really across all of these disease areas and have really significantly invested over the past years. Next slide, please. The other part, and you will have heard of that, is our 100 days mission. The 100 days mission really goes back to the huge ambition to make vaccines available in really only 100 days, or at least to make them ready for initial authorization and manufacturing at scale within 100 days. This is a long-term goal. This is nothing that we will achieve with the current BDBV outbreak in DRC, of course, but it is an ambition to really accelerate vaccine development even further as compared to the COVID pandemic. Next slide, please. So one instrument that we are using in CEPI is really our work in partnerships with networks. And this is just a selection of networks. We have more networks, but I think one of the networks that you came across potentially was the centralized lab network, our first network, currently a global network of 17 laboratories to support priority pathogen vaccine research and development. We have a preclinical models network, we have a manufacturing network, and I will focus on the Clinical Research Preparedness Network, which is very active in 3 regions nowadays, in East, Central, and in West Africa. Next slide, please. And on the next slide, you will see an overview of where we are and what we do. So we are really very much concerned about emergency response. We are collaborating extensively with supra-regional entities, for example, such as Africa CDC, for example, with the West African Health Organization, especially for Lassa fever. I will come to that in a second. And also other regional bodies across Africa. We have focused so far on these 3 priority regions, as you can see. We have launched this program in West Africa in 2023 purely due to the reason that we had this very well advanced Lassa fever portfolio that we would like to advance quickly. We have expanded in 2024 to East and Central Africa, and we are currently planning an expansion to South Asia. Sustainability, and I will talk more about that, and we are certainly always talking about sustainability, is really something which is actually really core to this program. We are really convinced that only true co-creation with regional partners, alignment with national priorities, sustainable funding mechanisms for clinical research sites, and proactive inclusion of existing research networks and engagement with other funders is contributing to long-term sustainability. Only by doing that, we can maximize the impact of funding. I'm trying to speak a little bit slower. I'm aware that we have interpreters on the line. So what we do with these programs is we have facilitators, and we call these facilitators technical coordinating partners, TCPs. We have onboarded these TCPs purely due to the fact that they are very experienced entities that can implement and facilitate the work with the regions to then hand the program and the established structures over to regional stakeholders. So all of the TCPs, except, as you can see here, MRC Unit The Gambia, will step back finally and hand over everything that we have invested in to regional stakeholders. Next slide, please. So we are operating with 2 separate tracks for the research preparedness program. The first one is really, we also call it track A, is really the support of routine advanced stage clinical development of portfolio vaccines. So we take, for example, Lassa fever as an example. We provide a lot of technical support to our vaccine developers that are funded through our portfolio. We promote the conduct of early vaccine trials on the African continent. We provide some targeted strengthening of the clinical trial ecosystem in the regions. And we also provide several other things that are necessary to conduct safe vaccine trials. And one of the most prominent examples is really our vaccine safety and pharmacovigilance processes and infrastructure that we try to deploy. The second track, which is really very much connected to the first track, is really then taking this beyond our vaccine portfolio. And we are asked the question, how can we actually bring the countries in a position to use all of these capacities and capabilities to respond to future outbreaks, irrespective of the pathogen that is causing the outbreak. So how can a country like Nigeria, and Nigeria is certainly very well set for this, but maybe any other country in West Africa as well, how can they respond to a completely different outbreak in 2 or 3 years' time with the capacity or the capabilities that we help to build? So we are trying to enable rapid research response in outbreaks. We support sites with capabilities necessary to quickly pivot from routine to emergency evidence generation. By the way, we know there are many excellent sites doing routine research all the time. What we have learned through many stakeholder engagement is really that many of these, even very experienced sites, they struggle to pivot to emergency response because there are no processes in place to review research protocols, clinical trial protocols, and applications quickly. There are no fast-track processes introduced. There is not enough personnel that can be deployed in emergencies, and we are trying to enhance that. Also, we are certainly promoting sustainable approaches to ensure capabilities can really last at the site level. So, and I think we heard it just in the beginning from Dr. Aishat. Of course, investments in preparedness must be made in inter-epidemic periods, and only those investments can meaningfully support swift emergency response. And we try to remember that even when there is no outbreak. Next slide, please. Some key principles on the next slide, and I will very quickly move through them. We are convinced that we need to mutually facilitate this approach. This is why we onboarded TCPs. Sometimes even TCPs who are not from Africa, because they can mutually orchestrate the work and connect stakeholders, and they will move away. We always build on the existent. As I said, we have many excellent sites. Why not using them? We have not built a single new site without a clear purpose, and we will not do this in the future. We will just use what is there and try to enhance capabilities. EDCTP3 is one of our key partners here. We focus on local guidance and ownership. Sustainability can only come through local commitment. Then another very important point, interoperability of capacity. I think I made the point at the beginning. We are very concerned about agnostic approaches. So while we are building capabilities and capacity to advance Lassa vaccines, we are thinking about Marburg and Ebola as well. We are also thinking about hypertension and diabetes, because this is actually what will keep sites and research centers alive in the future. Everything what we do is completely open access. CEPI has no rights to own anything. We do not want to own anything. We make everything available, and we advocate to others to use what we have built. And also we want to leverage what is there in terms of networks. Next slide, please. So again, 2 tracks. I will now take a little deep dive into the approach in West Africa. I mentioned under track A that we have focused on Lassa fever. We have onboarded these 2 TCPs, and for track B, so the emergency track, we have very closely worked together with Africa CDC, with WAHO, but also with all countries in West Africa, all 15 countries, to really come to really have a better idea of what is really needed, which gaps we can really meaningfully fill from CEPI's end, together with other funders, to advance research preparedness. Next slide, please. And this is just to say that I will now focus a bit on track A and really show a bit what we have done to advance Lassa fever vaccine development in West Africa. Next slide, please. And what we have done via the technical coordinating partners is really we have strengthened clinical trial capacity. If we can go to the next slide. We have advanced clinical trial capacity at 5 clinical trial sites. The slides are not advancing for me. I hope it's not my... Thanks. Now I got it. So on this slide, you can see that we have selected 5 clinical trial sites purely due to the fact that they are located in highly endemic regions for Lassa fever. For the Lassa, especially for the Lassa late-stage clinical trials, it's very important that we have high case numbers. So we focused really on Nigeria and on Sierra Leone for this. And you can see here, and I will not go through all of this, we have really, in a very careful approach, looked at all of these sites, and then really in record time, thanks to all the hard work that was done by the local staff and by our partners at all of these hospitals, have helped to create this capacity. And you can see the capacity here is really the recruitment capacity per day, which can be achieved after activation of this site. it's really enormous. And I really would like to thank everybody and congratulate to the success that has been made here. It's very important to mention that all of these sites would be able to recruit after a short ramp-up period, and that's a huge success. I also want to mention that we have installed a first mobile clinical trial unit. We know that outbreaks most of the times take place somewhere far away from the capital of country. So we need to think about mobile, flexible elements that we can deploy to these areas to let exactly those populations participate in clinical trials. And we are currently testing this unit. Next slide, please. Just to show some other examples, because it's not only about infrastructure, as you know, we have, together with partners on the ground through the TCP, established numerous standard operating procedures across different fields: clinical operations, laboratory workflows, data handling, community engagement, and so on and so forth. We have introduced corrective and preventive action processes to address issues systemically. We have, in short, really tried to empower all of those sites to contribute to research and to make sure that clinical trials can be conducted. Next slide, please. Training, certainly an important factor. We have really provided hundreds of training, I would say, across the sites, across really different roles. All of the professionals in clinical trials have been trained in their domains. You can see just some examples. Considering time, I will not go through this. We can go to the next slide. And this is then maybe the most important thing I would like to highlight is the community engagement. And I think by establishing community advisory boards at all of these sites, really going into the communities, and that has all been done by the hospital staff and by the partners on the ground, I think we really laid the foundation for vaccine trials, for Lassa trials that are on their way and will be conducted then. Next slide, please. So now let's have a closer look at track B before I then close my presentation. Track B, just as a reminder, in parallel to all of the capacity development that we did for Lassa, we convened big stakeholder engagement together with Africa CDC. And I think the first one was also hosted by the West African Health Organization to work on questions like how can we make sure that we can, as a region, as West Africa, better respond to future outbreaks. And this led to the development of a guidance document by Africa CDC. This is currently under final review and will then be published as an African Union document, which is then outlining the strategy and methodology of a hub-and-spoke clinical trial site model that will be implemented by Africa CDC. And we are very happy to facilitate these implementations starting in West Africa. Next slide, please. This is a very, very brief outline of the hub-and-spoke clinical research network as we envisage this to look like. Please just note that the image on the right-hand side is just for illustration purposes, so it's not said that where the hubs and where the spokes are located. That will follow a very stringent prioritization process, which is very nicely described in this guidance document. And this is certainly not an idea that comes from CEPI. This really goes back to the 10-year roadmap to optimize efficiency and impact in the clinical trial ecosystem, which has been published by Africa CDC and Outer NEPAD some years ago. Important to mention as well that all the sites are fully established. The model really focuses on existing infrastructure, and there are two main goals. First goal is really to enable research sites to rapidly pivot to outbreak response and generate evidence in future emergencies. What do the sites need to do that? We will try to supply all of what they need to do in the coming 2 years. Second goal, to enhance international cross-border coordination of evidence generation in future outbreaks. That has been a notorious bottleneck across the regions. So this is just then from a clinical trial side perspective, a perspective on what this will then at the end mean. Clinical trial sites at the end of the day will be enabled to rapidly generate emergency evidence in outbreaks. There are several benefits why those sites should be used in outbreaks. Certainly they are all experienced. They are very well linked up among each other. Many of them will be part of many networks, especially the EDCTP networks. So why are these sites then well positioned to pivot to outbreak response? They are prepared in peacetime. and they can access what we call pool of resources. And that goes all the way from access to deployable experts across the network, even across the regions, tailored SOPs developed by the partners, by the people on the ground, embedded really in national frameworks, established connections to regulatory entities and pre-agreed pathways, and so on and so forth. And certainly all of this will be built into a framework which is still needs to be established, and where the West African Health Organization will also play a role. Africa CDC certainly has the mandate to coordinate on a continental level, but the West African Health Organization will be vital to help to make all of this happen then in the West African region. Next slide, please. And I think this is my last slide, and I really try to answer a bit the question that has been posed at the beginning. How can research investments strengthen epidemic preparedness in West Africa? I think first and foremost, as I said 2 times already, ecosystem preparedness must take place in inter-epidemic periods. Strategies must be developed and owned by the countries, not by CEPI, not by anybody else. Supporting clinical research sites in conducting high-quality research in inter-epidemic periods is significantly supporting the ability to generate evidence in emergencies. A GCP-compliant trial is already a big endeavor. It's highly important and highly difficult to do this for a site. To do this in emergencies, it's even more complicated. So we have to train in peacetime. Preparedness plans must leverage existing infrastructure and capacities, and investments must be targeted and aligned with the real needs to meaningfully close gaps. This is what we have done so far in West Africa. Capacity strengthening should have disease-agnostic components to increase the likelihood of sustainability. As I said, we are aware clinical trials on medication for hypertension, diabetes, this is the future, not only clinical trials on vaccines against pandemic-prone diseases. This will not keep sites alive. And then, and this is some homework for CEPI and others, collaboration among funders is key to avoid duplication of efforts and to ensure available funds are well spent. So we have to align. We should not reinvent existing wheels. We should not duplicate. Targeted investments in coordination of outbreak response can support cross-border collaborations in future outbreaks. This is what we are doing by investing really at several levels. We are also funding Africa CDC. We're working with the West African Health Organization as part of the Lassa coalition very successfully. These are all targeted investments. And then last but not least, support of regular outbreak simulation exercises can really support a swift and well-coordinated evidence generation in future outbreaks. And this again is something that CEPI is also doing and will do in West Africa. So I would like to thank you very much for your attention, and I'm very happy to take questions.
Thank you so much, Christoph. Wonderful, wonderful presentation. And you have actually set the scene, and I believe the atmosphere is charged now for the panel session. Once again, thank you so much, Christoph, for that presentation. All right, so the next section of this webinar will take a deep dive into the conversations relating to our topic for today. And I would like to respectfully call my colleague who is going to be moderating the panel session, the project lead for the CEPI project, Nigeria Health Watch, Mayowa Ede. She's going to be moderating the panel session. Hi, Mayowa. Great to have you.
Thank you, Dr. Uwa, and welcome to everyone. Bienvenue à tous. It's great to have Dr. Christoph set the scene for the conversation we're going to have with the panelists. I will be doing a quick introduction of all the panelists. We have amazing people that are going to build on the conversations that Dr. Christoph has started. And I'll just be doing a quick introduction of our panelists. First, in no particular order, we have Dr. Rina Doshi. Dr. Rina Doshi is an epidemiologist and global health expert with 15 years experience in immunization outbreak response. And she also has experience in public health research across Africa and other low and middle income countries. She currently serves as the Emergencies Immunization Officer at WHO Regional Office for Africa. That's what we call WHO AFRO, where she leads efforts to strengthen the use of vaccines as a key component of epidemic and preparedness, pandemic preparedness and response. Before joining WHO, Dr. Doshi spent a decade at the U.S. Center for Disease Control and Prevention, that's US CDC, including as an Epidemic Intelligence Service Officer. She has supported vaccination strategies for major epidemic-prone diseases, including Ebola, cholera, Mpox, yellow fever, and COVID-19. And she has also led significant research initiatives, including a pediatric clinical trial on fractional dose yellow fever vaccination and a vaccine-preventable disease survey in Democratic Republic of Congo. You are welcome, Dr. Orina. Next, I would like to welcome Dr. Ahmed Futa. Dr. Ahmed is a medical doctor, epidemiologist, and clinical trial specialist, serving as a capacity strengthening lead and clinical trials coordinator at the Medical Research Council, MRC Unit The Gambia, at the London School of Hygiene and Tropical Medicine. Dr. Ahmed leads regional initiatives across West Africa to strengthen clinical trial capacity, research preparedness, and epidemic response systems, with a particular focus on building sustainable infrastructure and workforce capacity for diseases such as Lassa fever. His work focuses mainly on developing clinical trial sites, innovative research, infrastructure, and preparedness systems that strengthen countries' ability to respond to emerging public health threats and generate high-quality evidence during health emergencies. You are welcome, Dr. Ahmed. Also, we have Professor Yusuf Bara Jibrin. Dr. Jibrin is a professor of medicine, infectious disease, and a chief medical director of the Abubakar Tafawa Balewa University Teaching Hospital, ATBUTH in Bauchi. A fellow of the West African College of Physicians, he has over 30 years of experience in infectious diseases, clinical research, medical education, and health leadership positions, including as the Dean of Faculty of Clinical Sciences, Provost of the College of Medical Sciences at ATBU, and the Pioneer Chairman of the Medical Advisory Council at ATBUTH. Dr. Jibrin has led major research initiatives on COVID-19 and Lassa fever, including the WHO Solidarity Plus trial and CEPI-supported research capacity strengthening projects in West Africa. Dr. Jibrin is widely recognized for his contribution to infectious disease research, public health response, and medical training in Nigeria and the region. You are very welcome, Dr. Jibrin. Can I confirm that all our panelists are able to have their videos on? Okay. We're going to be talking with these three amazing experts around how Lassa fever investments are built structures in clinical research and response capacities through the Lassa fever coalition. We'll also aim to uncover any fragilities in the systems that have been built and how these platforms can be sustained. I really like the fact that Dr. Christoph had mentioned around some of the recommendations from the work and all the work that's been done in building those clinical sites, track
Hi, Dr. Hamid. Please confirm you can hear me. Hello, Dr. Hamid.
Hello? Yes, I can hear you now.
Oh, great. Thanks
All
so
right.
much. So I guess the first question we're going to put to you is, could you share a bit of the work that MRC Gambia has done to strengthen vaccine and infectious disease research capacity in West Africa?
All right, thank you very much for the question. So the Medical Research Council unit, the Gambia at London School of Hygiene and Tropical Medicine, has an almost 80-year history of conducting research into infectious diseases that are relevant in Africa, including malaria, tuberculosis, pneumococcal disease, meningitis, etc. And over the years, the unit has generated a lot of scientific evidence in addition to investing heavily into developing people, developing the systems, and developing the infrastructure that is required to conduct research to international standards. This includes strengthening clinical research facilities, lab capacity, quality management systems, data management platforms, and then also training the next generation of African researchers. The unit has played a significant role in the development of several vaccines, including the RTSS malaria vaccine, which had some of the very initial efficacy trials conducted in a malaria endemic population in the Gambia. We've also contributed to vaccines such as the pneumococcal vaccine, which is a 10-valent pneumococcal vaccine, and MN5 vaccine, which is a pentavalent vaccine. More recently, as Christophe has mentioned, we've been supporting a CEPI-funded initiative, the Advancing Research Capacity in West Africa project, AQUA, along with our partners, the International Vaccines Institute from South Korea. We've been working with them to develop capacity across sites in West Africa, including in Nigeria, in Sierra Leone, and in Nigeria and in Liberia, to develop agnostic capacity for clinical research, including Lassa fever research. And I'll say the approach that was used in AQUA really focused on the entire clinical research ecosystem. So capacity was developed for infrastructure, for workforce capacity, and also for building systems for conducting research. Thank you very much.
Thank you so much for that great insight, I would say, into the investments that have gone into, R&D across the landscape in the region. So I want to sincerely thank for the technical itch we had with my colleague. So I'll hand over to her now to continue the conversation.
All right, thank you.
Thank you, Dr. Ahmed. I was lucky to catch the best part of your speeches where you talked about how much MRC, the unit, has done to advance research capacity. So based on all the work you've done working across the region, just like you mentioned, can you share with us some of the things you have learned about running multi-country trials across different regulatory and operational settings, especially for disease of public health importance? You did mention some of those that you've been working on over time. So we're curious to learn about your experience and what you have learned so far from running multi-country trials.
Thank you very much. So for multi-country trials, I'll say one of the first important things will be to invest in stakeholder engagement. I think it's important to get all stakeholders involved very early on, just so you get the buy-in of everyone involved. So sponsors, investigators, regulators, ethics committees, ministries, all of them, should be brought in early. So that we right before even some major decisions have been made, so the studies progress with everybody's buy-in. Secondly, I'll say it's important, whilst we are looking at standardization and flexibility in running, once we're looking at standardization in running multi-country trials, flexibility is also equally important. So whilst we would like to harmonize study implementation, we want to ensure laboratory procedures, quality systems, safety reporting are harmonized. It's also important to ensure that implementation, flexibility in implementation is also considered so that the local context of the different countries is taken into consideration in the implementation of the studies. And finally, I would say from observation, sites that have preparedness is extremely important. So sites that have very well-trained staff, have established SOPs, quality systems, and regulatory readiness tend to activate studies more quickly and generate the evidence that is needed more easily. Thank you.
Okay. Thank you so much, Dr. Ahmed. I mean, investments in stakeholder engagement and flexibility in implementation, that is key. And I think it also feeds back to the scene set by Dr. Christoph at the beginning. Dr. Jibrin, welcome. Please confirm you can hear me and you can speak.
Yes, I can hear you.
Great. Okay. So speaking of sites that have conducted Lassa fever studies. I know ATBUTH, Bakatafewa Balewa University Teaching Hospital, has recently become a site for one of the largest Lassa fever epidemiological studies. That's the ENABLE study. And it's also a part of CHAMS, one of the world's largest child mortality surveillance networks. What investments, partnerships, and institutional capacities have enabled ATBUTH to take on these roles? And how have these resources that have been invested strengthen, or how can these resources strengthen broader preparedness for Bauchi State, in your opinion?
Thank you very much. ATBUTH Teaching Hospital Bauchi is located in the northeastern region of Nigeria, comprising of 6 states. And the estimated population of the region is about 34 million people. Bauchi State, as you are aware, is one of the states in Nigeria with high burden of Lassa.
Can anybody hear me?
I think the sound is off. I can't hear Prof. Jibrin.
Okay. Prof. Jibrin, we can't hear you. If you can hear us, I don't know, maybe it's the network that's gone off. But it's fine. I think, Dr. Rina, I think we'll just go back to you and give Dr. Jibrin time for his network to settle down. WHO AFRO has been involved in coordinating vaccine research during emergencies, including for Mpox and currently for the Bundibugyo Ebola Virus Disease. From your perspective, what progress has West Africa made in building research-ready systems, and what capacities?
Okay, I'm back. Sorry, I don't know whether I can continue.
Okay, please continue, Dr. Jibrin. Dr. Rina, please forgive us. We'll come back to you right after Dr. Jibrin. Please continue, Dr. Jibrin, if you can hear me.
Thank you very much. Thank you. So the investment done in ATBUTH Bauchi has actually strengthened the research infrastructure we have, and has a very good impact in the preparedness we going to have in terms of research and health security. Because we have now required to conduct Lassa fever, therapeutic, and vaccine trials, as well as other research that is going to take place during outbreaks. And we have a remarkable improvement in our research governance, data management system, laboratory capacity, specimen handling procedures, cold chain system, infection prevention and control measures, and quality management processes. This investment has not only created Lassa fever research, but other established diseases that may likely come. We are ready to go into it. The approach has remarkably has a reduced number of or the time required to transit from outbreaks detection to research implementation. And we also have a very good sustainable workforce that is in place, because the research investment that we have through the Lassa project have been able to train multidisciplinary team comprising of clinicians, pharmacists, laboratory scientists, data managers, and study coordinators in good clinical practice, good laboratory practice, biosafety, outbreak research, as well as clinical trial conduct. And the capacity building efforts have created a cadre of professionals now in our hospital that not only are capable of conducting Lassa fever studies, but also prepared to support research and response actively to other infectious disease threats. At ATBUTH Bauchi now, the competencies that we develop through these programs have strengthened our readiness and enhanced our ability to participate in regional and international research collaboration. And other clinical areas that we are able to have progress has been in the area of review of clinical trials, protocols, as well as ethical requirements to do some researches. Especially our local ethic group has been well trained to review clinical trial research proposals that is going to be implemented or be done in our institution. And apart from that, we are also looking at the development of multi-pathogen research capability. As I mentioned earlier, it's not only research on Lassa fever. The lesson we are able to acquire has given our experience to epidemic preparedness, not only one specific organism, but a platform has been established for Lassa fever research that is beyond the Lassa fever alone. And the workforce we have in our environment also, in terms of laboratory, community engagement structures, data management platforms, and governance mechanisms developed in Lassa can be leveraged for studies involved in other viral hemorrhagic fevers, as well as other infectious diseases in the region. So actually, we have a very good investment that really going to be well utilized in future epidemic responses. Thank you.
Thank you so much, Dr. Jubreen. I'm sure every stakeholder here is excited to know that we have a research-ready site that is fit for purpose, is disease agnostic, is ready for regional and international collaborations with well-trained multidisciplinary teams. Thank you so much, Dr. Jubreen. So back to you, Dr. Rina. We're talking about the work that WHO AFRO has been doing in coordinating vaccine research, during emergencies. So I was wondering, from your perspective, if you could share with us what progress you see that West Africa has made in building research-ready systems and what capacities require further investment to meet future outbreak threats.
Yeah, no, it's a good question. And I think that there's been a lot of progress made. And I think one of the biggest things I would say is this stronger recognition that research must be part of outbreak response and not an afterthought during response. I think that's the biggest thing that we've seen. And I think all the speakers have already highlighted that. I think this experience really increased after the West African Ebola outbreak in 2014 through 2016. One of the things that I have seen, and some of these things I'll say we've seen improvements, but there's also still room. And one of those is improved ethics and regulatory review processes in many countries, especially in West Africa. Some of the West African regulatory processes, some of those organizations are very strong. And I think that other countries in the region can learn from that. There's also greater capacity, I think, for clinical trial implementation, also the community engagement and partner coordination aspects. Actually, as we think about BVD trial sites, I think there's a lot of possibility to have trial sites in West Africa, given their already expertise. So I think that's really huge, and want to congratulate West Africa for that. I think in terms of further investment, I would say that we still need to see these pre-approved adaptable protocols that can be readily activated during outbreaks. I think throughout the continent, we've seen some countries start to move towards that. It's something we've been working on a lot on the WHO side. However, we're not quite there yet fully. I think sustainable national data systems and research infrastructure for these data systems is really key. And we still haven't seen that fully functional. And I think that can be another area for improvement. I think I highlighted community engagement as a strength, but I also think it's an area that's room for improvement. When we think about any outbreak, community engagement is always key. And I think as humans, we need to recognize our limitations and realize that community engagement is a lot harder than we realize. And so building trust needs to be established before the outbreaks occur. And again, that's really hard to do and not something that we can just do quickly and overnight. I also think we need to think a little bit more about readiness for pathogens beyond Ebola virus disease, beyond Sudan, Marburg, and other emerging threats. We're doing a lot of work at WHO on pandemic influenza, and thinking through some of the other diseases like respiratory viruses are really important. And finally, I mentioned that West Africa has done a lot of work and has some strong regulatory organizations. And I think there's still room for improvement across the board. We saw that a lot with Mpox as we tried to vaccinate throughout the continent. And so I think there's a lot of things that the sub-region can transfer to some of the other sub-regions throughout the continent.
Thank you so much, Dr. Rina. I like the fact that you have managed to reinforce all of the conversations that we've had here today. And I think one big thing we're learning is we build trust in the time of peace and not the time of an epidemic. Dr. Christoph also mentioned that. But I would like to know if there are recommendations from your end on what governments, regional coordination bodies, research institutions, and partners should prioritize. I mean, you mentioned a lot of things that need improvement, right? But what, in your opinion, should these major stakeholders prioritize in order to turn disease-specific investments into long-term multi-pathogen preparedness? I mean, you had mentioned some of them already. Data management systems, infrastructure to house these systems, improved community engagement. But what, in your opinions, are some of the other things that they should prioritize, governments, research institutes, and partners, to be able to turn disease-specific investments into multi-pathogen preparedness?
Yeah, so I think really focusing on developing and maintaining national research preparedness plans will be really key, or making sure that research is part of a national preparedness plan, if not separate. I think we need to think about how we can invest in research infrastructure and workforce capacity between those outbreaks. I think somebody mentioned, a lot of workforce capacity around GCP, and making sure that we have a large cohort of trained staff in the period between the outbreaks. Again, I highlighted this before, but I think strengthening the ethics and regulatory system for rapid emergency activation. At the regional office, our AVRF team is actually working on guidance for emergency review, regulatory review, and that will probably come out in the next year. And I think doing some trainings around that would be really key. Again, ensuring that research is embedded in those plans and the response frameworks as well, not just the preparedness plan, but the response. Whether that's research for medical countermeasures or that's operational implementation research. All of that should be prioritized. I think that's really something that we're seeing as important with the ongoing BVD outbreak. I would also say that at the regional level, we can start to think about harmonizing protocols and regulatory approaches across countries so that countries can learn through experience. And this also ties into this cross-border collaboration and data sharing, which is really key. I mentioned too that I think West Africa has this strong network of trial-ready sites, and I think some of those sites can be used to increase the number of sites throughout the region by supporting peer-to-peer collaboration or south-to-south collaboration. I could go on forever, but maybe I'll stop there.
Thank you so much, Dr. Rina. I mean, you gave some very good points there with our need for collaboration and data sharing, our need to prioritize research, not just as an afterthought, but people need to begin to think about research more as a preparedness plan. When you're planning for your national response, research should be a priority as well. Thank you so much. Dr. Jibrin, I will come back to you after this interesting conversation with Dr. Doshi, especially because you are, very involved in the research as it stands now. And I was wondering, based on all the work that has been done in ATBUTH, especially around the ENABLE study, what lessons from that research and from the ENABLE study do you think can inform the next generation of preparedness investments? Dr. Jibrin, can you hear me? Are you there?
I can hear you, yes.
Okay, great.
Thank you. Thank you very much.
Yeah, I was wondering what lessons from ENABLE should inform the next generation of preparedness investments and what it will take, in your opinion, to build resilient, research-ready institutions that can respond to future epidemic threats in the light of what we know now, that when it comes to epidemics, it's not a matter of if, but a matter of when. So what, in your opinion, are some of the lessons you can share?
Thank you very much. Our experience in ATBUTH Bauchi is that there is need for collaboration, community engagement, and institutionalization of all intervention that will come to an institution for sustainability. What we realize is that the ENABLE study, as well as the SBS study, which is all sponsored by, supported by CEPI, has given out the experience now that the state government has to be involved in what we are doing. We have to reach out to them for advocacy and then awareness and making them to be part of what we are doing in the state, not only within the hospital alone. And that has given us that ownership and that bond between us and the state government, as well as other ministries that are important in epidemics, especially Ministry of Agriculture, Ministry of Livestock, Ministry of Water Resources, as well as Ministry of Environment. So all these have been engaged during these ENABLE studies. As such, we are now working as a team, and we have one common goal. What do you do if there's an epidemic? How do you respond? Okay. And we have some partners within the state also that are supporting us in terms of clinical care, in terms of case findings. All these people have been keying into what we are doing. Most importantly is the community engagement, which has been mentioned earlier. Actually, currently we have a community advisory board, which are very active. And what we did was to make them know that this particular exercise is going to be ongoing. It's not only for the program we are doing now. In case there's any other epidemic, then we are going to utilize them. It's just a matter of activating them. And then our hospital also now have a team that is supposed to be in liaison with the community at all times. So what we do is we make sure that we have some program within the community, like clinical outreach, medical outreach, to see that actually they are part of them and we're giving them some support. And this one has given a very good lesson in terms of preparing.
Hello, Dr. Jibril.
Thank you. Hello,
okay, we can hear you. Yeah. You went off for a minute. Yeah.
Okay. So actually what I say was that we have a team that composed of the state government, the community, and then the institution staff that are working with us. And I think we are having a very good experience with the ENABLE study to make us have a team that we can, tackle an epidemic that will come in the near future. Thank you.
Thank you so much, Dr. Jibrin. So you know how they say time flies when you are having fun. I've been told that I am out of time for this conversation with the panelists. I can't believe the time went by so fast. We're having such very interesting and productive conversations. So what we're going to do right now is going to the question and answer session. If you have questions for the panelists, please put them in the Q&A box and we'll read them out so that the panelists can respond to some of your questions. We have 4 questions presently, and I think I'll just take them quickly for the panelists. Okay, I think we have one question. I think this is for, okay, let me read it then. The panelists that is, we'll assign it to the panelists. Given the insecurity in some parts of the West African countries, which has hindered health workers to swiftly respond to and embark on disease surveillance, what is the West African Health Organization doing to maintain peace and security in the region and uphold health security according to UNDP, knowing fully well that conflict and war could have grave impacts on health systems? Dr. Aishat, I assume this question is for you, is asking about WAHO's role in conflict and peacekeeping in the light of degrading health systems due to insecurity. Dr. Aisha, I believe you can answer this question if possible.
Yeah.
Is Dr. Aisha on the call?
Yeah, I'm too. Go ahead.
Yes. A question came in apart from the ones to join the West Africa Health Organization. One person was wondering how, given the insecurity in parts of West Africa, which has hindered health workers' access to respond to and embark on disease surveillance, what the West African Health Organization can do to maintain peace and security and uphold health security according to United Nations Development Program, knowing that this insecurity has a big impact on health systems. So how are you managing the conflict and its impact on the health system in West African Health Organization?
Thank you very much, Mayor, and thank you to the questioner. So West Africa Health Organization is a specialized health institution within the Economic Community of West African States. And broadly, the issue that has to do with security is actually within the mandate of ECOWAS, not necessarily WAHO. And I believe that there are a committee and a directorate within ECOWAS that deals with peace and insecurity within the region, and looking into this. And secondly, the issue of insecurity also has to do with each member state to be able to see how that can be dealt with. So in summary, the issue of insecurity does not necessarily lie within the mandate of WAHO, but there's no doubt that insecurity also affects the delivery of healthcare systems within the member states. And also to the question on how to join WAHO, let me say WAHO is an organization, but it's not joining by membership. It's a technical organization and with professionals in there. So, and time to time there are job vacancies being advertised that all qualified members from West Africa can apply to. Thank you.
Thank you so much, Dr. Aishat, for that brief response. The next question, Dr. Christoph, is for you. It says, following Dr. Christoph's insightful presentation, how can cross-border regulatory frameworks be designed and maintained during peacetime to enable rapid evidence-based decision-making during an epidemic while preserving transparency, accountability, and public trust? Did you get that question, Dr. Christoph, or do I have to go again?
No, I got the question. Thank you very much. And a very good question, to be honest. Not sure if I can give the answer, but I think our attempt is really, and I must say that we have a very active regulatory affairs department, is really to connect with stakeholders on the ground, especially in West Africa. And we heard just previously from the other speaker that the regulatory infrastructure and the national regulatory agencies, as well as ABREF, are very active, especially in West Africa. We need to initiate those discussions. So what we are doing, for example, from a clinical development standpoint, is really that we initiate discussions on protocols for outbreaks. So we have mock-up protocols for certain scenarios that we discuss with countries, with regulators. And we need to have these discussions in peacetime, in inter-epidemic periods. And, with this, or by doing this, we can stimulate the discussion and, create maybe awareness among stakeholders what it needs to take or what it takes during outbreaks to really turn around these protocols, adapted protocols then in this case, in a very short period of time. At the end of the day, stakeholders on the ground have to tell us how we can support them to maintain all of this. I think one key element is really that we make all of this available on an open access platform. And this is what we are working on, so that this can be shared and owned by everyone, and that research can provide input into those protocols. I hope that helps.
Thank you so much, Dr. Christoph. I think that's very clear. Dr. Ahmed, the next question, coincidentally, is for you, I assume. It says, how do we transition research-supported laboratory capacity into fully budgeted national lab programs after projects end? And how can we ensure that investments for one disease such as Lassa fever do not remain vertical, but strengthen the entire integrated lab network? Dr. Ahmed, is it something you can help respond to, please?
Thank you. I'll probably start with the last question before the earlier one. So in terms of ensuring that capacity that is built is not limited to one pathogen, I'll say, for instance, with the AQUA project, we made an effort to ensure that agnostic capacity was built, so that we're building capacity and preparing our institutions for all pathogens, not just one. I mean, today we are talking about Lassa fever, but in the next few months, it may be something else. So we need to prepare our institutions agnostically to be able to be ready for the next pathogen. And then the first question was about, I think that had to do about sustainability. Yes.
Yeah.
I know quite a lot of times we have funders like CEPI, bringing in the funds to develop capacity and all of that. But what do we do to ensure that this capacity is maintained when that funding is not there? I think that's a question for all of us. How do we ensure ownership of building capacity and ensuring that we are able to fund and maintain the sustainability of the capacity that has been built? Again, I'm going to throw that question to all of us. I think that's a question for all of us to think about how we can ensure this. Thank you.
Absolutely. I think it was mentioned by every panelist here how we need to think not just of scalability, but of sustainability beyond the existing programs that we have. Thank you so much, Dr. Ahmed. A question for you, Dr. Jibrin. It says, congratulations, Professor Jibrin. What is your assessment of the ongoing therapeutic trials for Lassa fever in Nigeria? In your view, what are the main achievements so far, and what key challenges remain to be addressed?
Thank you very much. The ongoing Lassa fever vaccine trial is promising. Based on the preliminary result we have seen, actually is promising. And some of the centers that are involved in that trial have the capacity to do that. And what we need to do is to expand, because this kind of trial has to be multi-centered, because there are a lot of other areas that have peculiarity in terms of the geography as well as the people there. So what challenge I'm envisaging is that the capacity to do the research in terms of human capacity as well as the infrastructure. So I think there is a need to engage other partners and at the same time try to see how the government will key in. We shouldn't leave it only to the partners in terms of sustainability, as we have mentioned earlier. So I think these are something that I think we should do. Thank you very much.
Thank you. National ownership is what you're emphasizing. Thank you so much, Dr. Jibrin. This question, I'm not sure who can answer it. Maybe it's for anybody, or sorry, all the panelists I meant to say. It says during the COVID-19 pandemic, significant investments were made to establish and strengthen molecular laboratories. However, today, only a minority, estimated at about 20%, remain functional in a country such as Nigeria. What does this suggest about the sustainability and preparedness of these labs for future public health emergencies? And what steps do we think are needed to restore or maintain their readiness? Dr. Rina, you have done multi-country programs, and you can give us experience from the different regions, those that are lacking and those that have done well in establishing and maintaining such laboratories. Maybe you can talk a bit about what can be done to maintain readiness for labs that have been built, especially those that we've seen go down since the COVID-19 pandemic. You can talk about your multi-country experience with us in answering that question, if you don't mind.
I'm not a laboratory expert. However, a lot of work has been done through the pandemic influenza program that I mentioned a little bit, which stemmed a lot. It's been around for quite some time, but, was kind of staffed up a bit more with the COVID-19 pandemic. And so, I think one of the things that is important is building this capacity for the laboratory to do some of these molecular techniques. I can't say why exactly that some of these things have been delayed, but WHO is doing a lot of work with building the capacity around some of these labs, working with larger partners such as IPD in Senegal, also on the other side of the continent, UVRI, to do a lot of the work. And same with the ongoing BVD outbreak, working closely with the national laboratory there to bring some of the capacities around these reference laboratories to other laboratories in the region that still need strengthening. And maybe other colleagues can contribute more to that.
Absolutely. Thank you so much, Dr. Rina. Dr. Ahmed, you have also experience with the MRC units that you can probably share about how you've seen probably where after, we did start to talk about it, how some programs are not sustainable beyond the project year. And you see some of the labs that have been established after the project ends begins to do less than what it was established to do. In your opinion, can you help answer what steps are needed to restore and maintain readiness for labs that have been established by programs such as the CEPI program, Lassa Vaccine Coalition programs, and other research programs across the region? What can be done to restore or maintain their readiness for future outbreaks so that we don't lose all the investments?
Yes, I think this brings us back to the sustainability question. So really, after the outbreak, there's a lot of capacity that has been built. There's a lot of infrastructure, equipment that is available. So how do we ensure that we are using these equipment and that they do not degrade while not being used? I think this is where, we need to have our scientists applying for grants, conducting their own research, essentially keeping themselves busy, keeping their labs busy during peacetime. And I think this is the only way we can sustain this kind of investment.
Okay, thank you so much. Dr. Jibrin, please, I would like your thoughts on this because you are the one that is actively working now on the ENABLE study and other research studies. What do you think can be done? You talked about a lot of investment that has gone into your research preparedness, including staff training, including equipment. What can be done to maintain it even after projects end or after an outbreak, for instance?
Thank you very much. Sustainability is key. Apart from sustainability, we also have to talk about maintenance of the equipment that they are very expensive maintenance equipment, and then calibration of this instrument in the laboratory. And to do that one, we need inflow of some funds, and the funds shouldn't be left only from the partners, as I mentioned earlier. A lot of activities can be happening in the institution that we can utilize the facility to do them. For example, if you are doing viral load for hepatitis, why can't you use the same molecular lab and do it? And then you can get some fund, and then activity will be continuing, and then some income will come. Another thing is collaboration with other institutions. We shouldn't just leave the institution that is having the capacity on its own and an isolated island. Other institutions near to the area, for example, if you talk about Bauchi, we have other tertiary institutions within the zone. We can reach out to them, or they can reach out to us and see how we can collaborate in some few research that can be done, and can collaborate in having a proposal to get grants, and the grants can be utilized, to fund the laboratory and establish other satellite laboratories within the region. So I think collaboration and putting our funds in one basket will make important in terms of sustainability. And then the workforce also, we need to also invite other people to come and see what other institutions are doing. We shouldn't just leave to ourselves. All the sources we have been mentioning, other people should come and see. You should do some benchmarking to see what we are doing. So that one will, give a way for, sustaining the workforce that we are having, and then we're extending our capacity to other institutions. Thank you.
Thank you so much. I think the summary of everything we've said today, sovereignty of, ownership of your research processes in country, collaboration within and outside the country, collaboration amongst diseases. He talks about hepatitis and, using what has already been established for other diseases, not specific to, probably the one the research institutes were established for. So with this, I guess we've come to the end. I will give all the panelists 1 minute to share your closing thoughts before we take the closing remarks. We'll start with the order in which we spoke. I'm going to start with you, Dr. Ahmed. You can give your closing remarks, and then Dr. Rina, and finally, Dr. Jibrin. Please, Dr. Ahmed, can you give us your closing thoughts in 1 minute?
Okay, thank you very much. I think we've discussed a lot, but I think one thing I'll just highlight here is that preparedness is important, and by talking about preparedness, we do not need to wait for the next epidemic. This is the time to prepare for it. So we need to start building the systems, start training the workforce, start building the infrastructure, so that by the time, we are at the next outbreak, we're very ready for it. Thank you.
Thank you so much, Dr. Ahmed. Preparedness is key. We need to prepare in the time of peace and not in the time of war. Dr. Rina, please give us your closing thoughts in 1 minute.
Yeah, I think we've heard this theme over and over again, right? That we need to prepare ahead outside of the outbreak. And I think we need to also capitalize on the experiences that we've had. We've talked about this already, where West Africa is relatively ahead, right? Experience from the Ebola outbreaks and the subsequent investments that were made post-Ebola. I think the other thing that I've mentioned throughout all of the things I've said today is this peer-to-peer South learning. Take that information that you have here in West Africa and take that to the rest of the continent, where they may not always be as advanced. And then I think also establishing these regional collaborations and networks so that we can facilitate sharing is really key, because during the next epidemic or pandemic, we need to work together, not separately.
Absolutely. Thank you so much, Dr. Rina. Collaboration and cross-learning is key for progress, for the future. Dr. Jibrin, please give us your closing thoughts in 1 minute, if it's okay by you.
Thank you very much. I will emphasize on community engagement. You see, whatever you are bringing, the community are the one that will benefit. So if you don't engage them early, by the time you come with something new, innovation, new intervention, they may reject it. And a lot of misconception, a lot of rumor that will be coming. So when you engage early, then you are going to have, the understanding and then support. So I think we should do much during when there is peace or when there is no epidemic. Let's engage them very well. Again, we should do a lot of benchmarking. Let's visit each other. Let's visit the institutions that have some capabilities and learn from each other. And then those who have also, let them also share their knowledge with other people within the region. Thank you very much.
Thank you so much. Research cannot progress well enough without engaging the communities you're working with and without, learning from each other and cross-learning. I think that's been the central theme for the closing remarks from all panelists. Thank you so much. It was a very interesting conversation with all the panelists. I had so much fun. I didn't even know time was gone. So I would hand over now to Dr. Aishat to give us the closing remarks, and then we will end this webinar. But before I do, please, can we take the time to fill out the feedback form? We can scan the QR code that is coming up on the screen now, or we can check in the chat box. It has been, a link is there for us to, give our thoughts on how we can make this better for all of us next time. Dr. Aishat, over to you. Thank you.
Thank you, Mayora, and distinguished panelists and dear colleagues. I want to thank you for your insightful presentations and our participants for their active engagement and valuable contributions. Today's discussions have highlighted some important key areas that we need to look at collectively. We've mentioned the issue of sustainability and ownership, looking beyond donor funding. And also, we've also discussed about making sure that the investments that we have on Lassa fever can be extended to other infectious diseases. And also, we talked about some of the challenges, which has to do with human resource capacity and also infrastructure for research within West Africa. We also highlighted the importance of collaboration and cross-learning among colleagues. In WAHO, we're committed to making sure that some of the priority research areas within our region are being followed, and we are also putting together a network of researchers within the region and also universities and academic institutions to see how we can work together and pull resources together to ensure that we build capacity within the region. So on this note, I want to extend my appreciation to the organizing team and also our technical and development partners present here today. Thank you so much, everyone, and have a pleasant evening. Thank you.
Thank you, Dr. Aisha. Thank you, everyone. Enjoy the rest of your day.
Thank you.